I'm the first Saudi dietitian who graduated and practiced the profession of dietetics. At the same time, I'm the head of the clinical nutrition department at King Abdulaziz University, Jeddah. Today, I'm gonna give you some idea about the benchmarking that we use, or the comparison that we've done for our program at King Abdulaziz University with the European programs using the benchmark statements. And why did we do that comparison? Because actually we are required to be accredited nationally and internationally by the one of the international institutions. And while we are planning or going through the process for benchmark for accreditation by one of the European international accreditation system or process agency, so I thought about doing some comparison with the European programs in dietetics. Going through some backgrounds and aims, you might be familiar with the benchmarking, the definition of the benchmarking, which is, there is many different definitions, but the one I've used, which suits my study, it's an organization attitude for employing best practices at best cost. It is important process for improving performance of a company, public organization, program, or a university. Kelsen also said that the process needs to continuously identifying, understand, and adapt outstanding practices and processes inside and outside organizations. So recently, the attitude for the health care systems is to use the concept of benchmarking, either on a clinical based issues or academic based issues. The benchmark statement for the European dietetic benchmark that was EFAD, which is the European Federation of Association of Dietitians, states that an initiative undertaken under the guidance of quality assurance to describe the nature and characteristics of higher education programs in a specific subject, while representing general expectations about the standards for an award or of qualifications at a particular level, or articulate the attributes and capabilities that those presenting such as qualifications should be able to demonstrate. As we said, the statement was recommended by the EFAD to be used by national organizations, those providing education concerning curriculum planning and or development, and we use it because the program was already developed in the academic year 2004 and 2005, but we used it because we were looking about how to sustain and develop our program. And as I told you, that was for the sake of getting the international accreditation by the European agency. The benchmark could be used to internally or externally declare quality and standards. EFAD provided a clear plan for the education of a dietitian in Europe. And dietetics in Saudi universities, including King Abdulaziz University, are included in the curriculum of Faculty of Applied Medical Sciences. The program that I'm talking about at the moment, and that we compared with the European standards, is considered the second program in Saudi Arabia and the first program in Jeddah city. This program, or as we call it KAU, or King Abdulaziz University Clinical Nutrition CLN program, started, as I said, in the academic year 2004 and 2005, which currently enrolls more than 100 undergraduate students. The average is 30 to 35 graduates per year. So the purpose of this comparison is to measure the KAU first cycle clinical study program, as we only have at the moment the first cycle. We didn't start any of the second cycle programs or the postgraduate programs, but we are starting it next year, hopefully. And qualification standard, then compare it with the European standard based on the EFAD approach. The design is a benchmark with European dimensions in our curriculum content, use of European credit accreditation and transfer system, ACTS system, as you all aware of. Methods of assessment of students' professional agency that set objectives of the program, and for sure, we took an ethical approval from the committee for the Applied Medical College in order to access data or publish these kind of data. Although most of the data that we've used is being published on our website. The KAU division of the theoretical program, the results out of this comparison showed that the KAU division of the theoretical program follows the European standards and include basic sciences, food, nutrition and sciences, food services administration, nutrition education, and community nutrition. So with regards to the topics or the courses, we are following the European standards. Similar to some European countries, we found that our theoretical program is designed as problem-based learning, where all the 5 groups of study or courses are integrated together. EFAD, the European Federation of Association of Dietitians, suggests students to follow a first cycle course which carries a minimum of 210 ACTs points for the theoretical part and 30 ACTs points for the practical part. So our program uses a KAU credit system, okay, which is American-based system, which equals to, when I calculated, it was equals to, it's 137. However, when I compare it with the European system, it came up, it's equals to 342, which is more than the European one. I mean, the credit hours for the theoretical part. Moreover, we have a 1-year internship that should be the students, all senior students, they should go through it after they finish the 4th year. For the national requirements, EFAD compares if there is a national requirements for contents of dietetics programs, and the clinical CLN include their dietetics education program under faculties for health programs, particularly in the curriculum of faculties is called exactly the faculties of applied medical sciences. Looking at the teaching and learning process based on the ADBS, the approach of the European countries for dietetic educations, methods for teaching, learning, and assessment are defined by the department and made to match the learning outcomes associated with health professional programs. We will still continue to develop our teaching programs and the methods of teaching, and we are measuring that using KPIs, with benchmarking with external and internal institution, or with ourselves internally, with others from year to year, and we are evaluating that annually by the quality and accreditation team. That didactic program, our program is didactic, is combining the theoretical and the practical part, and based on the EDPS, academic and practical elements are required for qualifications as a dietitian. Our program, or the KAU program, integrates dietetic education and practice. The number of weeks for practice is 8.5 weeks, which is within the range of the European countries who they require to the average, the range between 2.5 to 8 weeks. Regardless of the training type, field work, in the 4th year, which is usually conducted in hospitals, or during the internship placement, where our students has to have a placement in one or more than one hospital, Admission to training in most European programs requires 5-level subjects concerning the natural sciences, mathematics, national language, or international language, and the European standards, they prefer if the program is it's in English, and our program is in English. And practical experience, as I mentioned earlier, that we are doing the internship in hospitals. And plus three month part of the internship, they are doing it in one of the field work. They are doing it as a field work or in the community or community-based one. It is obligatory for the clinical senior students to submit a research project report using research methods for passing the examinations. We do mock viva for them, although it's too early, but we succeed in that, and we're unique in that among other health professional programs. We do invite external examiners for these research projects to evaluate it every year. And we invite clinicians, parents, and academic consultants in the medical field to attend and critique these kind of research. Graduation is connected with registration with one of the profession governing and the Saudi registration agency for health specialists. They, at the moment, they do register then automatically when they finish their internship. However, starting from this academic year, a test or an exam is going to be going on. The only part which is we're not happy about it is the Saudi Dietetic Association is not taking at the moment part in with the registration of these professionals. So it's only the general, as they call it here, what do they call it in the UK? The one that they register all health professionals, the one for health professionals. Yes. So. That's, but however, Saudi Dietetic Associations, they're not taking any part in this registration. In conclusion, comparable qualifications were recommended by IFAD in 2005 to support the European labor market, enable dietitians to study to study and work more easily through the European Union. It is also expected that students need and demand qualifications which can be used effectively for the purpose of studies. All over the Europe. In 2016, we found out that the results of the present benchmarking for a program, for the KEU program, with IFAD assertion that the KEU students will have no difficulties in making further education and or practice their profession or even work in the European countries. And we do have some experience with many of our graduates that they came and worked in the European countries, especially since the program is currently accredited by a European institution, which is called the Accreditation Agency in Health and Social Sciences and is based in Germany. This is our certificate for accreditation. I would like to thank and acknowledge our president of the university, which really encouraged me to present this paper, and he was happy about it. Also the dean of the college who gave us the permission to use any data, and the vice dean for development. Also, I would like to thank my colleague, Dr. Nahla Khalifa, which is not here, but she's going to speak tomorrow, and we really appreciate what she's done. She's the developer of this program. Also, I would like to thank my son, Ahmed, for his proofreading.